The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk. Welcome to another episode of The Healthy Image, where we talk all things health and wellness. Today we have a very special guest, Dr. Luis Gutierrez, who is an expert in all things musculoskeletal radiology. He is one of our very own from the Hill Medical Corporation. So welcome, Dr. Gutierrez. We're happy to have you on.
Thank you for having me. This is very cool.
Yes,
Excited.
We're very excited for you that you're here and excited to have you as our guest.
Yes.
I do want to honor your bio. You have extensive work and it's very, very impressive. And we can sit here talking about your work all day. Your achievements are incredible. So let me take the time to honor your bio. Dr. Gutierrez is a board-certified radiologist and a specialist in musculoskeletal imaging at the Hill Medical Corporation with a bachelor's degree in biological sciences from Stanford University and a medical degree from Stanford School of Medicine. Dr. Gutierrez completed his residency at the University of California, San Francisco, where he served as chief resident in diagnostic radiology. He then went on to complete a specialized fellowship in musculoskeletal radiology, focusing on sports injuries, inflammatory diseases, bone tumors, and minimally invasive interventions. Dr. Gutierrez's clinical work and research have been published in top journals such as Skeletal Radiology, and he has presented at major radiology conferences, including the Radiological Society of North America, RSNA, and the International Skeletal Society annual meeting. His compassionate and evidence-based approach to care makes him a trusted leader in his field.
Thank you for that.
Absolutely.
Took me back
Impressive.
down memory lane there.
It's incredibly impressive.
So before
you.
we dive into today's podcast, could you share with us your journey to getting you into skeletal muscle health?
Yeah, for sure. So thank you for that. It's a pleasure to be here. This is super fun. And thank you for that bio. Like I said, that took me down memory lane, but I think it all started way before that. My interest in medicine and science and just whole body health. So I remember when I was in 5th grade, I was a pretty kind of sedentary kid. I would just go to school, do my homework, go home, do nothing. And then one day I just saw a flyer that said, play AYSO soccer. And I was like, oh, that's cool. And I had a lot of friends that did that. And that was kind of my first moment of I want to be in sports. I want to do something with myself. I want to do something other than just school. What can my body do? That was kind of my first interest in sports. And so I did it. And I wasn't very good for the first few years. But over the next, 3 years, I got really good. And my body changed a lot. And that always stuck with me. I was like, wow, this stuff, running hard, training hard, being consistent, being a good teammate, really does change you. It also taught me discipline, aside from just changing me physically. I felt smarter. And so from then on, I was just hooked with sports. And so I played soccer throughout middle school very consistently. And then in high school, I kind of geared up a bit more. I played football during the summer and during the fall. And then in the winters, I'd switch over to soccer. And in the spring, I'd switch over to track. And then I start over again. I did that all 4 years. And during all that, I kept getting stronger and bigger and faster. And I was like, this is really awesome. And through all that, I still did well in school. Like I said, I felt like it made me smarter. I excelled in the sciences, especially in mathematics. I loved biology so much. And I think the first time that I realized that I probably would devote my life to anything related to biology would be was when I took my AP biology course at El Rancho High School, Codans. And then I got into Stanford. I was very fortunate to get into Stanford, and so I knew that I was going to major in biology. I didn't think I would do medicine. because I hated the sight of blood. I just couldn't stand it. I couldn't watch vampire movies. I couldn't watch horror movies. I just would like feel so weak. And I was like, okay, that means I can't be a doctor. So I thought that I was going to be a biomechanical engineer. And I thought I would, create, prosthetic implants like prosthetic hearts, prosthetic joints, things like that's what I wanted to do, because I knew that somehow I wanted to deal with the body. But then I got to Stanford, and all my friends were going into medicine. Like, it was just like a very cool thing about Stanford that, everyone just feels like, oh yeah, I'm just gonna be a doctor. It's like not a big deal. And I was like, oh, like I've never really encountered that. And so I said, well, I'm taking all the same classes that all my colleagues are taking, and so I'll try it out. And lo and behold, I loved everything that had to do with the medical sciences. I volunteered in some clinics while I was in undergrad, and I said, okay, I'm going to go into medicine. And through all that, I kept, I wasn't in sports in college. I wasn't at the, D1 level for sports, but I kept up my training. I did weightlifting. I ran. I played intramural sports. And so through all that, I made sure that I kept my body healthy. And so then, I go a few years ahead. I get into Stanford Med School. Again, very fortunate for that. And I learned all the things that you need to learn for medicine. And a lot of the things that you learn in medical school are very, very common chronic illnesses like heart disease, brain disease, diabetes, strokes, things like that. But they don't really teach you the cool stuff like MSK health. They don't, because it's just not as big of a deal, because, you'll be fine. Like, you sprain an ankle, you're not going to die. You don't need high-level medicines for that.
When I started in this field in marketing,
Yeah.
I didn't even know what MSK was.
Yeah.
I couldn't even say, I still have a hard
Yeah.
time, but I couldn't even say musculoskeletal.
Yeah.
That was like cardiology,
Right.
oncology, like those were things that I knew, but I'm like,
Those are big deals.
that's
what you focus on.
MSK is
For some reason,
a
it's not
thing?
as sexy. Yeah.
Right.
It's
Yeah.
like, and it's true. And so in medicine, I probably had maybe a month of it. And I just didn't grasp it very well. So I felt like I graduated from med school not really understanding the musculoskeletal system and how it helped you. And so it seemed very niche. Like, you have to, if you were going to learn about that, you had to go into ortho or into sports medicine. But I was like, I don't want to be a surgeon. I don't want to be a sports medicine doctor. What am I going to do? Because I still love this stuff. And what I realized is that radiology really lends itself to really learning about this stuff, like in very good detail, especially musculoskeletal radiology. So I was learning about things, and I took like a elective class for like a month in Stanford, and that's when I kind of learned, okay, this is what I'm going to do. I love this. This is the anatomy. I'm learning the anatomy. I'm not just learning the anatomy, I'm learning how it relates to disease processes. And it was fascinating. And I wasn't just interested in in MSK. I was interested in all aspects of the body, but a bit more interested in MSK. And so then I applied to radiology for residency. I was again fortunate enough to get into UCSF. I've been fortunate. I don't know how I got into all these great programs, and I'm so fortunate. But I feel lucky. And so I was able to go to UCSF to train in radiology. And after 4 years, nothing changed. I knew that I was going to do MSK. Like, that's what I wanted to do. That's what I wanted to specialize in. I knew everything about radiology, but my specialty was going to be musculoskeletal radiology. So I did that for an extra year. And then I applied for jobs down here in Southern California, back home. And the Hill Medical Corporation hired me, and I've been here since, my dream job. And I get to read, I get to read a little bit of everything. But I love my MSK days where I'm just reading joints, MR knees, MR hips, things like that, shoulders. Very cool. So that's my journey. Sorry, that was kind of long, but
No, it's wonderful.
Yeah.
It just is such a joy to see how you light up and just expressing yourself on
Yeah.
something that you have such a passion about.
Yeah, it
and
is.
it's great when you find something that you truly love.
Yeah.
It
Yeah.
really is, and that you
Just-
get to do it every day.
Yeah, if you find that, just grab onto it and just keep going for the ride,
Absolutely.
Yeah.
Absolutely.
So let's start with the basics.
Yeah.
Why is skeletal muscle so important for your overall health besides just aesthetics and fitness?
Yeah. So I'll start off by saying, I'm a radiologist. But I am so I'm not I'm not like an endocrinologist who's an expert on or like a internal medicine doctor who's an expert on the body and things and hormones and things like that. I'm not an orthopedic surgeon, but I am aficionado. Like, I like to learn about this stuff, and I do read about it. And as a muscularologist, you do have to keep up with the times and keep up with these types of things. And I like working out. So, the musculoskeletal system, it's a very fun system, right? You work out hard, your body looks better, you get bigger, you get stronger, all that cool stuff that happens. You go to the gym, you have that social time when you're in the gym, you're surrounded by people that are having a good time. So all that stuff is really fun. And that's how I kind of, I related to working out in the musculoskeletal system for me for a long time when I was young. And then I had kids, and I said, what can I do to make sure, I had kids when I was like in my, late 30s. And so I said, what can I do for myself to make sure that I'm around when these kids grow up? And then I started thinking about longevity. What can I do to make sure that I live a long, full, and healthy life, and that I'm still able to keep up with these kids when they're bigger? And it turns out that just doing the same thing that I was already doing, working out, growing muscle, but for different reasons.
Yes.
So before it's just kind of like, oh, this is fun, it looks good, and it makes me look better in my clothes.
You're doing it for you, and now you're doing it for them.
For them, exactly. For my family, to live a longer life, to fight off disease, chronic disease.
Yes, absolutely.
So that's the main thing. And so when you start to think about, how do I make sure my heart's healthy, my brain's healthy, my liver, how do I prevent hypertension, diabetes, it all comes back to your musculoskeletal system, and it's so cool. And luckily for me, I'd already been into weightlifting and running and things like that, so I just kept doing it. I just did it a bit more carefully. Just to, as you get older, your joints start to hurt a little bit more. Your tendons start to stretch a little harder.
Yes.
But you keep doing it. But I think those are the main things that you should think about when you're working out and getting bigger and working on hypertrophy. It's not just because, as you get older, it's not going to be just about how you look, but it's going to be about giving you a longer life and a better life.
What are some of the lesser known benefits of maintaining a healthy muscle mass?
Yeah. So like I said, we touched upon, the well-known things are that you're going to get big and strong, right? And you're going to be mobile and active. Because it's going to allow you to go through life and do things. I think some of the lesser things are that building bigger muscles will help you fight off really bad diseases. And I see these diseases all the time, every day, too much, when I'm reading my scans, just like everyday scans. So they fight off things like diabetes. They fight off a cognitive decline, which you can see, with brain white matter lesions when you're reading MR brains. You can, and it improves metabolism, things like that. So if you're trying to lose weight, just get more muscle. And so I think those are the things that people don't realize, or just maybe they realize, but they don't understand how important it is. And so, like, for example, when we talk about diabetes, right? So diabetes is a big deal in my family. Lots of people in my family have diabetes, so it's especially important for me to fight that off. And the cool thing about building more muscle is that muscle is like a sponge for glucose. It's like it's the biggest system in your body that regulates glucose once it's in your blood system. Like, so you eat, your food gets broken down in your stomach and your guts into very basic elements like lipids, fats, amino acids, carbohydrates, and glucose. Well, once these things get into your bloodstream after they're absorbed by your guts, they have to go somewhere. They have to be used for energy. And the cool thing about muscle is that it's this big sponge, like I said, that takes up most of the glucose. All of your organs need the glucose for energy. But muscle is the biggest organ that needs it, and it takes it up via insulin, right? So the pancreas senses that there's glucose in your body and says, okay, we need to take care of this glucose, because if your glucose just runs around rampant in your bloodstream, it's going to cause some problems. So we need to take it up and use it for energy or store it for later. And so your skeletal muscle does that really well, and it's the biggest one that does that. So you can imagine that if you have a bigger sponge, bigger muscles, that you're going to be able to regulate that glucose much better. You're going to have better metabolism. You're going to be able to maintain your body weight much better. And I find that to be quite true. The more, whenever I get in shape, I'm like, one day I'll have like a cheat day, and like I just eat whatever I want, and the next day it's like nothing happened because it's like I think my muscles just took care of it.
Yeah.
But like just like a positive reinforcement, right? Like, okay, like this is really working. I'm gonna keep working hard to it. But then like times when I'm out of shape, when you're eating badly, that you feel it for a few days.
Mm-hmm.
Like you don't have the muscle to take care of it. So that's like kind of thing. And then you're like, I feel terrible, so I'm just not gonna work out anymore. So it's just like this
Vicious
downward
cycle.
slope.
Yeah.
Yes.
But anyway, those are I guess the other important things that we don't think about too much, but are critically important for maintaining a healthy life.
Oh, absolutely. And Dr. Gutierrez, you touched on so many wonderful points, which brings me to other questions that you've actually already answered, which is wonderful. I do want to share with you that I completely agree with you. When you do build muscle, when you notice that you have that cheat day, and I currently wear a continuous glucose monitor
Okay.
because I do have diabetes.
Okay.
And what I've noticed is that when I do have that cheat day, for some reason, my blood sugar continues to be normal in the 80s.
Yeah.
It's usually 84, 85,
Yeah.
even though I've splurged a little bit on something because I've noticed in my own personal journey, 11 months into weightlifting, I have
cool.
grown muscle. I still have baby muscles, but I have grown muscles that they're
Muscle
slowly
is muscle.
peeking out. Yes, they're slowly
Yeah.
peeking out. But there's the term muscle is medicine. And I truly believe that it is medicine.
Yeah.
And it helps so much in what we do in mobility and making us feel better and in regulating blood glucose within our systems. And I do notice for myself, I feel so much better. I have so much energy, and I don't have the crashes that I used to have when I do have, for example, if I decide to have a piece of cake or a small piece of a donut or, which I rarely do nowadays. But I think you've hit on so many wonderful points, especially with type 2 diabetes, also running in my family and so many families out there that it has touched many lives.
Yep.
But thank you so much for sharing that. That is important information.
Yeah. Mm-hmm.
Can you explain how skeletal muscle acts as an endocrine organ? What are myokines and what role do they play in inter-organ communication?
Yeah, sure. So actually, like I said, in medical school, they didn't teach us this. I didn't realize that muscle was an endocrine organ until very recently. So the traditional endocrine organs, when you think about the most common one that you'll hear about is the pancreas. And again, it goes back to diabetes. So what is an endocrine organ? So an endocrine organ secretes hormones, and these hormones then get released into the bloodstream, and they exert effects on other organs to dictate what those organs will do, what actions they'll take to whatever that hormone is targeted to do, right? So with insulin, so like we mentioned, you eat, your blood glucose levels go up, your pancreas senses that, and it secretes insulin to the blood, and it tells all the organs in your body, okay, time to work, time to take up this glucose out of the blood and take it into your cells. So, interestingly enough, muscle does something similar with myokines. So when you stretch a muscle, you go to the gym and you lift, several types of myokines are released into the bloodstream, and it tells all kinds of different organs in your body to do certain things, and they're all good things. Like in the brain, the myokines can get into the brain, and they can be neuroprotective. And what that means, it'll protect you from chronic diseases, especially we hear of Alzheimer's, Parkinson's, ALS, things like that. So it can protect you in that way if you make enough myokines over time. In the liver, it can promote improved lipid metabolism, which is important because I see so much fatty liver disease in my practice. Like, people just coming to the ER just for like some, just minor pain, and they don't have anything wrong, but lots of people have fatty liver disease. And why do we care about that? Well, when you have fatty liver disease, that causes inflammation in your liver. And chronic inflammation to the liver can lead to fibrosis and cirrhosis. And that leads to several other major problems. That leads to portal hypertension, it can lead, and then eventually to death, right? So these myokines, these things that I didn't know about until recently, actually have an important role in, improving your liver metabolism. They also have, effects on your immune system. It helps with anti-inflammatory and preventing inflammation in the body, or in terms of regulating that. And so it has all these other amazing things that help your entire body with doing good things that help prevent chronic disease.
And I heard that myokines, correct me if I'm wrong, but I've heard that myokines are considered hope molecules. There's a term out there that's trending about myokines being hope molecules. Can you talk a little bit about that?
Are you talking about their, in terms of how they may be related to like tumor suppression and things like
Correct.
that? Yeah. So I think this is kind of new, and I'm not up to date about this too much, but I think what they're seeing is that myokines, again, working with your immune system, can help with tumor suppression. Like they can help with, slowing down the growth of cancer cells, and they can help with tumor cell apoptosis. So one of the problems with cancer is that what happens is these cancer cells become dysregulated, and they grow uncontrollably. And normal cells in the body know that over time they should die off as a normal process called apoptosis. Well, cancer cells bypass that, right? And so that's why they grow uncontrollably, and then they eventually spread. And so I guess what they're seeing is that myokines can induce or can help induce tumor cell apoptosis. These things that they bypass that causes them to grow uncontrollably. They can apoptosis, the cell death. I think they're thinking that maybe we can, somehow come up with therapies that are based on myokines to treat cancer. I don't think we're obviously not there yet, but I think that's an exciting part of the field. Another cool thing about skeletal muscle that I didn't know, we didn't learn this in med school. That'd be a very cool emerging thing about, myokines.
Yeah, that is. It's so exciting. It sounds like, and I've heard the term that myokines are similar to having this pharmacy in your own body.
Yeah,
where
it seems that way, right?
Yes, absolutely. Where you do strength training, where you contract the muscle, and all of a sudden these myokines are produced. It's like our own body is healing ourselves.
Yeah.
There's also another term where I heard that the body is always looking to heal itself, whether it's doing it to protect yourself and in the process, something good comes out of it, or it's doing it for other reasons, but it's always looking to protect itself in one way, to heal itself in one way or another, including where, people get inflammation, and the inflammation tells us something. It's not just, oh, you have inflammation, but why do you have inflammation? You talked about fatty liver disease. There's inflammation there, but why is that inflammation occurring? So there's questions that I think, on top of questions that I think it's important to ask, but if it's leading to, well, there's, the insulin sensitivity is not necessarily there. There's the regulation of insulin, what's going on with that, because if the body's signaling is not working properly, then does that mean that there's inflammation that's happening? So, and then inflammation in the brain, and then just so much that's going on. And I just truly do believe, and of course I'm not a clinician, but I truly do believe the body's always trying to heal itself in one way or another.
Yeah.
Thank you. Thank you so much. And speaking of brain and cognitive function, what is and I know you talked about this somewhat as well, but what is the muscle-brain health connection? And in terms of maintaining and helping reduce the risk of cognitive decline, maintaining good brain health, preventing cognitive decline or dementia, how can we do that with skeletal muscle?
So I think the way I think of it is, I think, two ways. with that, so like we already mentioned the myokines, right? Myokines can, get into your brain, and through several complex cascades that go on, happen in neurons and that affect the cells, can be neuroprotective. Again, you can promote neurogenesis, like in the hippocampus. It can improve memory, things like that, or help with memory. And like I mentioned, neuroprotection against things like Alzheimer's, dementia, Parkinson's. It can cross, myokines can cross the blood-brain barrier and be these natural antidepressants that I think is super cool. But I also think that taking it even back to the basics, you know, when you have healthy muscle, that means that you have you don't have diabetes, right? And what does that mean? Well, people with diabetes, why do they get sick, right? So they have this glucose just kind of running rampant in the blood, right? And this glucose affects the blood vessels, the lining of the blood vessels. Okay, fine, whatever. Well, when you have this damage to the blood vessel walls, you start building up plaque. And what happens is that diabetes likes to really mess with the small vessels in your body first. And so you start feeling things like, and it also messes with your heart, vessels in your heart, and your brain, right? So then you start getting cardiac disease. You started getting brain disease. You start getting strokes, things like that. So by building healthier muscle, you're preventing that, right? You're preventing this vessel wall damage that will affect your brain. And you might not get a stroke, but you have what we see in radiology when we look at scans of the brain on CT or MRI. We see these what we call flare signal abnormalities in the brain and white matter, and that means that the brain has undergone some sort of damage, inflammation. And usually we say that it's non-specific, but for the most part, it's because of microvascular ischemic disease. Like these small vessels in your brains are damaged because of these small injuries that happen to the vessel walls. And I'm sure that these patients with these flare signal abnormalities in the brain, these white matter lesions, are having cognitive decline. They're having memory issues. They're having trouble performing tasks of everyday living, right? And so by having, a better musculoskeletal system, you're preventing that. You're preventing the vessel damage that can happen in the brain. Not just, aside from just the myokines getting in and doing all these wonderful things, it's also preventing damage that happens too frequently in our population.
In terms of skeletal muscle, how does that influence how we age, whether it's lifespan or health span? I know you touched on that a little bit, but can you elaborate on that a little
more?
Yeah.
So again, it all goes back to, we all age. We're going to age, right? It's just about aging gracefully and aging well, and aging by limiting comorbidities. And so the way you do that is by maintaining good cardiac health, brain health, good vessel health, metabolic health, and luckily increased muscle mass helps with all of that. Again, through myokines, through regulation of your metabolic system, things like that. But aging is also as you age, you also undergo what's called sarcopenia. You get muscle wasting, and that's just normal. So the way I think about it is like, I'm going to fight that.
Yes.
I'm going to go to the gym and fight that as long as I can. I know it's going to happen, but I'm going to fight it for as long as I can.
Slow it down.
Yeah, I'm going to slow it down. Why? Well, because I want to feel young for as long as I can, and because it's fun. It's just fun to just try to play with nature and just kind of fight against it and be like, I'm going to be as healthy as I can for as long as I can. I'm going to lift as hard as I can for as long as I can, healthy and safe, not, messing up my joints.
And
my
why
tendons.
not?
Yeah, why not? It's fun. I like it. And so that's the way I approach my life. I think, how am I going to feel better 20 years from now? How am I going to make sure that I'm going to feel good when I'm 60? And that I can, go out with my kids and have a good time. And it's by going to the gym, building more muscle mass, so that my heart stays strong, so my brain stays functional and good, and I'm avoiding these white matter lesions that I talked about, and that I'm feeling good, that my mood's good. And so I think all those things are going to keep me happy, right?
Yeah. And I'm sure it helps, preserve your independence and
Yeah.
prevents frailty, which, can happen as we age. Does skeletal muscle help prevent frailty as we age?
Yeah. So, so I think one of the things that I fear when I get really old is having a fracture. That's so scary. So, because when what I see like in older patients, like once you hit over 80 years of age, a fracture can be deadly. Like, fractures that maybe young people can, recover from very easily, like a hip fracture, that can be mortal, like
your child falls off the couch and they get back up and keep
Yeah.
going, but it's not the same when
in
you're
your
older,
80s.
right?
Yeah, that can be it.
Yeah.
And so, talking about frailty, how do I prevent, how to make sure that I prevent something like that from happening to me? Well, I want to be able to move well. So that means that, that goes along with, maintaining a good muscle mass, making sure that my good tendon health. So, making sure that you go to the gym and you lift well and appropriately and safely. And that in turn also will help with your bone mineral density. So I like to do a lot of heavy lifting and weight-bearing lifting. And some people tell me, I think there's cons and pluses, right? So I'll squat. I'm 40 and I'm still squatting. And some people say, well, you're going to mess up your discs. I'm like, yeah, you might be right, but I'm doing it safely. I'm doing it slowly. I'm doing weight that I can handle. And at the same time, I think I'm promoting increased bone mineral density, because that's important for me, because I want to make sure that that stays strong throughout my life, because I don't want to fracture anything. I don't want to have compression fractures in my spine. I see that all the time. I see people with osteopenia, like, too frequently. Their bones are just really brittle. And they might be in their 60s, and I'm like, I don't want to be like that. And hopefully by the time I'm 80, I still have strong enough bones where I don't have to worry about breaking like a hip fracture, like killing me one day.
Yes.
So those are the things that I think about in terms of frailty and how to prevent frailty and how to improve strength and the sturdiness of your body.
Right. Yes, and I think that is so important. I've heard that, having a hip fracture, falling when you're in your 7th, 8th, even 9th decade, it can be considered the kiss of death.
Yeah.
Because as you said, it would be very incredibly challenging to recover from something like that, especially in those decades.
Yeah.
Yes. And that brings me to my next question in regards to longevity about grip strength.
Yeah.
With grip strength is often considered a predictor of longevity. What does that tell us about the role of muscle and what it plays in health and survival?
Yeah, so this is like a really cool thing that I wasn't aware of until very recently as well. Apparently grip strength, just being able to squeeze something really hard when you wake up in the morning, is a good predictor of just overall muscle health. And I think that goes along with just being a good sign of how sarcopenic you are, how much muscle wasting you have. And so say, if for some reason your grip strength, a weak grip strength is indicative that you're probably sarcopenic, which then in turn means that you're probably not healthy. You don't have all these protective things that the muscle gives you, right? It doesn't regulate you probably don't have good regulation of your metabolism. You probably have, you're at risk for cognitive decline and things like that. So doesn't mean this grip strength doesn't just mean that you're just, overall frail and weak. It also could mean that you have other risk for chronic conditions, right? So I thought that was really interesting. Like, this one thing can tell you so much about your body. I think that's super cool. And I haven't tried it. Have you tried it?
No, I have not, but
Yeah.
I will plan on
Yeah.
it. And
We should probably do this on a podcast and see like
in
who has the bigger
fact, I am going to. I'm going to take you up on that. Now
Let's
that
do
you've
it.
brought it
Yeah.
up,
I think that's a good idea.
I'm going to go see you at the hospital, and I will have you do the device.
Yeah.
And we can all do it. That way, we could see where we are,
Yeah.
and perhaps we'll get some of the other doctors in the
Yeah,
group
right.
to see.
See who wins.
Yes, exactly. Who has the best grip strength? And speaking of grip strength, I think that with longevity, when we're talking about just regular, normal daily activities of what we do, when we open a jar, that's also grip strength.
Yeah.
When we're lifting a bag of groceries,
Yeah.
that's grip strength.
Opening a door.
Exactly, opening the
Yeah.
the knob of the door.
Yeah.
I'm holding my phone, I'm holding the mouse on the computer, I'm opening the iPad,
Yeah.
I'm opening the door of
Very
my
true.
car. I'm doing so many things each and every day, all day long, that have to do with handling something with my hands. And I think that, when I do get to my, God willing, I get to my 7th decade, 8th decade, and even 9th decade of my life, I want to be able to be healthy enough to do those things myself. And longevity is so important to me, because I also have children too, and I want to be able to see my children grow up and my grandkids and be around for that and be able to chase them and play with them and do all the fun things that grandparents get to do.
Yeah.
So that's exciting. And I think taking care of ourselves right now is truly important.
Yeah.
Absolutely. What kind of exercise is most effective for building and preserving skeletal muscle? And how much do people really need to reap the benefits?
Yeah. I mean, that's a loaded topic, right?
Yes.
I'm sure
Yes.
so many fitness influencers have so many different opinions,
Yes,
right?
absolutely. And I know that you also lift weights,
Yeah.
as you've said. Is
Yeah.
it mainly focusing on like the bigger loads, like the squats or the lunges or the chest presses, or what is it that people can work on now when they're 20s, 30s and 40s and 50s and so on to have more longevity later on?
Yeah, I think it depends on where you are in your journey, right? If you're a beginner, I think you start off with whatever you can do. You just get to the gym. Just build that commitment, number one. Build that mental commitment to yourself to just get in there, whatever you can do. Don't pay attention to anybody else.
Yeah, create the habit.
Create the habit.
Yes.
Just get in there if you're a beginner. And if you can afford to get a personal trainer just to teach you how to do things safely.
Yes.
And if not, YouTube it. Learn how to do it safely, because you
Yes.
can really hurt yourself if you're a beginner and you're trying to push big weight. So don't try to copy other people there, because you never know if people are actually doing something, correctly. I see big guys in the gym.
That's true.
I'm like, slow down there, man.
And me, I'm like, okay.
Yeah, no. I'm
Yes.
like, that's a little dicey there.
Yes.
But they can do it, but they might not be able to do it forever. So I think, make sure that you do things safely if you're a beginner. If you're intermediate to more advanced, start pushing yourself and play around with different types of workouts. I've gone through several iterations of light weightlifting. Like, what should I do? So for the longest time, I was an advocate of doing, 3 to 4 reps and doing 3 to 4 sets with 12 reps each time. So a set is, if you're going to do a bench press and you lift it up for 12 times, that's one set with 12 reps, right? And so I was like, that was always what I was taught in high school, and so that's what I always did. And then I got bored with it, and I kind of plateaued. And more recently, I started hearing, which is working for me, doing less reps with higher weight, as long as it's safe. As long as your form is perfect, as long as you're doing it under, controlled, but pushing it to the max weight that you can for 6 to 8 reps. So not the 12 reps.
So read to exhaustion. Yes.
Yeah.
Okay.
But with heavier weights. And I found that my strength and my hypertrophy has really gone up. And I don't know if that's just a result of, that itself, that type of training is what's done it, or just that I changed. I don't know. But it's working for me right now. And like you mentioned, I always think about, how do I build my glucose sponge to be bigger?
Yes.
How do I fight diabetes? And I do focus on the bigger muscles, like earlier in the week. So like today, I went into the gym and I did my chest. I did really heavy sets, and then I did pull-ups, my back. So those are like two big muscle systems that I've worked out. And, I felt like I like doing that because when I do my chest, my back isn't fatigued. So I can still work it out really hard. Whereas before, I do bench press, and then I do incline press, and then I do flies. And by the time I get to my flies, I'm like, my chest is fatigued, and I can't push the weight anymore. Like I'm already like barely like doing any like mini flies. And I found that if I do those 3 different chest exercises on 3 different days, now I'm much more powerful, and now I'm like really like lifting a lot more. So like so now what I'm doing is I'll do chest and back alternating like in one day, and then the next day I'll do a similar thing, but like with an incline or like with rows, things like that. And that's been working for me. And I kind of just invented that for myself just because I just felt, this is like actually making me grow a lot more muscle. I feel better. I don't feel like I'm getting hurt. Because, when you work out the same muscle too much the same day, it also kind of fatigues your muscle and your tendons, right?
Yes.
So I found that I was getting a lot of tendinitis. And when you get older, that can last for like 3 months.
Oh, wow.
It can really put you out.
Yes, and I heard also to split it that way, you also give the muscle a chance to recover too and rebuild too.
Yeah.
So that's a great way. I've heard other individuals have done that too, where they split it up throughout the week. They work on certain. They'll have a leg day or upper body day.
Yeah.
Or even a full body day as well. But then they split it up too, and that's where some people have seen the most gains too when they do it that way.
What do you like to do?
I like to do squats. I like to do deadlifts, but
Me too.
I enjoy deadlifts. I also do bicep curls. I do the pull-ups as well in the pull-up machine.
Okay.
I enjoy that as well.
Yeah.
Lunges. I do a lot of lunges, a lot of RDLs.
Yeah. So you're hitting all the big muscle groups.
Yes,
Yeah.
I love that, and I will split it up as well. But I do have at least 2 full body days.
Okay.
And I also get in my cardio too.
I was going to say, how do you get your cardio in there? What do you do?
Well, first off, every day I try to hit at least 10,000 steps.
Okay.
So that's
great.
on the side. Even on my rest days, I still do my 10,000 steps, and I keep my watch. It tracks my steps.
Yeah.
So that's how I
You can't
monitor
forget
that.
your watch, or else it'll never happen.
No, I even sleep with my watch because I'm tracking my sleep too,
Yeah.
because muscle recovery, sleep is so important for that, which I'm sure you know. So for me, that's what I do. And so I do my cardio. When I do my muscle days at the gym, I will work on my muscle, and I'll probably do that for about 50 minutes or so, and then I hit the Stairmaster.
Cool.
I end off with the Stairmaster, and I'll do that for about 20 to 30 minutes, and then I go. And on those
Very
days,
nice.
I'm still hitting. Actually, I hit more than 10,000 steps
I
because of the
imagine.
Stairmasters too.
You can imagine as a radiologist, I have a hard time hitting those 10,000
Yes.
steps. I'm just sitting all day. I kind of wish, I've thought about buying one of those little mini treadmills. That
Yeah, the walking pads.
The
Yeah.
walking pad under your desk.
Yeah,
yes.
just to hit those.
Those are
It's so
very
important.
popular here.
Yes.
We
Oh,
all,
yeah?
Yes.
a lot of
Okay,
us have
maybe
it.
you guys
I can show you mine
Maybe you
when
can hook me up with one.
I'll show you
So
mine.
put it
I
under the
have
radiology desk.
absolutely. I have a rising desk, so we'll go downstairs afterwards.
If you're in a
Yeah.
Zoom meeting with us, just everyone's heads are.
yes, because
Bobby.
we're
I didn't
walking.
notice.
Yes.
Yeah, it's really hard as a radiologist. So what I'll try to do is sometimes if I have enough energy after a workout, I'll run for 30 minutes and I'll try to hit as many steps as I can. Like usually I try to hit 3 miles. And that gets me to about 7,000 steps.
That's awesome.
Yeah.
Yeah, that's awesome.
But sometimes I can't hit it.
Well, thank you so much for joining us. This
Thank you
was
for
a lot of
having me.
fun.
This is fun.
Thank
Let's
you
do it
so
again.
much. Yes,
learned
we
so
will.
much. Yeah.
I learned a lot too. Thank you so much. It's been a
Yeah.
pleasure.
Likewise.
And this is an amazing topic for the audience and for us as well. Thank you again.
Thank you. Thank you for having me.
Thank you for tuning into the Healthy Image podcast. Please make sure to like and subscribe or share with a friend. And as always, stay curious, stay engaged, and stay healthy. Thank you.
Thank
Bye.
you. Bye.
Bye.